Hello and welcome today. My name is Kevin Rockwell, and we're going to be talking about neurofeedback. I'm joined today by Carl Shames, who works with his patients to help them using this method of treatment called neurofeedback. Welcome, Carl.
Thank you. Glad to be talking to you.
Carl, if you could, first of all, maybe you could go into your background before you started doing this neurofeedback training, sort of how you got involved in this field and what led you to this method of treating folks.
Okay. I worked in the mental health profession for over 40 years as a psychologist in clinics, hospitals, private psychotherapy, and among other things, I saw, there's sort of limited effectiveness to the techniques. That the methods really boil down to either medication or talking to somebody. Recently, there's been a little more development. There's EMDR, there's movement and somatic therapies, and so on. But that's very recently. I started looking around for a kind of a more holistic approach, and I came upon this neurofeedback, and it's the most exciting, amazing work I've done in my entire career. I just love, seeing what it can do for people, and I'm trying to get the word out so that more people are aware of the possibilities.
So, just maybe before we talk about exactly what folks can get treated with this, talk about maybe the core differences between traditional psychotherapy and using neurofeedback to deal with people's problems.
Well, it's totally different. Neurofeedback grew out of the biofeedback practices, which developed in the 70s, aimed toward helping people learn to relax. Then someone got the idea of seeing, well, can biofeedback work with brain waves to see if people could sort of re-regulate their brain waves using the biofeedback. And to make a long story short, first they were trying it with cats, then they tried it with people, and so originally they discovered that it worked very well with seizure disorders. So that's how it kind of came about. But it's a whole different realm than psychotherapy. Psychotherapy works like, let's say somebody has anxiety. Psychotherapy would address it by talking about what made you anxious, what happened in your childhood that set you on this path of anxiousness. Neurofeedback is an entirely different approach. It just works with the brain, the imbalances that have developed in the brain. And that might have come about, maybe you were born that way. Some people are born with tendencies to anxiety. Or it may have developed through experiences that you had where your brain sort of got locked into an anxiety pattern and hasn't been able to get back out of it. But one way or another, it's in the brain, and so the neurofeedback actually rebalances the brain or brings the brain out of that pattern into a sort of smoother way of functioning. So it's totally different from psychotherapy. In my observation, a lot of what psychotherapy has tried to accomplish, so for instance, what I just said about anxiety, the neurofeedback actually can directly accomplish it, and it also saves people from having to take medication. I would estimate that over 50% of people who are taking psychoactive medications today would not need them if they had done neurofeedback instead. And I know that's a very amazing thing to say, but I'm actually understating it. I would estimate it's closer to 80%. I honestly believe that.
Well, just in America today, there's millions of people that are taking drugs for their depression, their anxiety, whatever it might be. So what you're saying is that there's many of these people could benefit from neurofeedback and not be doing it for years and years and years.
Absolutely. Now, I'm not going to say it's a simple question like, oh, if you've been taking antidepressants for 20 years, come and have a few neurofeedback sessions and that'll be that. In many cases, it's a long, complex process. Now, for many people, let's say somebody with anxiety or sleep problems, if they had done neurofeedback originally, uh, that would have been a very simple thing. Probably 10 sessions, 15 sessions would have solved most of the problem. But let's say they've had 20 years on various medications, especially the sleep medications, which are very addictive. But also, let's say, antidepressant medications. Their system has become plugged into those medications and dependent upon them. So, and many of those people believe that they just need that for the rest of their lives. But the fact is, almost everybody, if they have a proper diet, get a decent amount of exercise, take nutritional supplements that support the hormonal system and the neurotransmitters, the brain functions, and neurofeedback, very good chance that over a period of time they can eliminate or at least reduce their dependency on medications and live a better life, because with medications you always have some side effect, and it's always sort of it giveth and it taketh away, let's say. ADD is a good example. Many kids, I'd say the majority of kids are on ADD medication. With neurofeedback, at least 50% of them could eliminate the medication, and at least another 30% could reduce their medication.
That would be very strong, good news, I imagine, for millions of parents who are dealing with this situation. If they could either get their kids off the meds or reduce them, that seems like that would be terrific news.
Yeah, absolutely, and I'm kind of understating the case here because I don't want to sound too outrageous, but it's really amazing. But it's not well known for reasons that we may or may not get into. The medical profession and the pharmaceutical companies are not exactly jumping on this to get the word out, and most people realize that the physicians, they do their thing and they're in their world, and so the word really hasn't gotten out yet about just how effective this can be. And so I'm hoping, through these videos and other means, I can help get the word out.
We've talked a little bit kind of generally about it. Before we go into exactly how it works, tell me about some of the different types of issues that you help people with. We mentioned ADD, but maybe you could kind of go through a list of all the different types of issues that you help folks with.
Okay, well, it's a long list. It's anything that has to do with the brain not being balanced properly. And what's amazing is that a lot of what we had thought of as in the psychological realm really turns out to be in the brain realm. And I think that's one of the key things to understand. ADD was one of the first things that really showed it's not a psychological problem. And that's why it originally was termed minimal brain dysfunction. The idea being that it's not psychological. If this kid is jumping around, can't pay attention, can't sit still, it does not have a psychological cause. It has something else. And the cause is in the functioning of the brain. So ADD was the first place that was really recognized. Other places recognized, of course, is seizure disorders and migraines, things like that. So those are the obvious ones. But then let's take PMS. A woman who has severe mood swings during PMS gets really sad, gets weepy, gets very irritable, gets angry, stuff like that. Well, she experiences that as her, and her husband or partner experiences that as her personality. But it turns out it's her brain reacting to the hormonal changes. So it's not in her psyche, really. It's in her system. And similarly, you say a man who has anger management issues, which may or may not be connected. I don't know. But I've had men who have lifetime of anger management problems, and after just a few sessions, end of problem. We've just gotten rid of it. And it's very dramatic because there was something off in the brain that caused them to go off like that. So what had seemed to be in their personality turned out it was really in this system of the brain functioning. And so that's the main lesson to learn when we think about neurofeedback. It's not just a new modality, but it's really telling us something new about how we function and making us rethink a lot of the way we understand people. Because a lot of what we thought was in this realm of the psyche, that's something, oh, Johnny is anxious because you know, when he was 3 years old, his father did this, his mother did that, you know, if you read Freud or whatever. Well, it turns out, you know, he may be anxious, just his brain is tuned that way. He may have come into the world that way. It may have been experiences of something that happened at birth. For some people, it might have been a mild head injury. Maybe he got hit in the head with a baseball bat, and his brain got sort of untuned. So there's all kinds of ways that the ADD, anxiety, sometimes depression, although I would have to say depression is a little difficult to deal with. Oh, I should have had my list with me.
That's okay. So
I want to mention one type of case I've been dealing with. There's kids who get diagnosed with ADD, but or they're a little bit of ADD and a little bit autistic. The doctors don't really know what to do with them, and there are really no treatments. And I see it a lot where it's not exactly ADD. Very often these kids are adopted. They've had very traumatic births and early childhoods, and so they have what's called developmental deficiencies, but it's sort of multiple. It's no one thing. So then as they get going in school, they just can't function very well. They don't function socially, emotionally, they have temper tantrums or whatever. And so there's no one diagnosis that they fit into. Are we back on now?
yes, yes, there
Okay.
we go. So Carl, you were talking about the kids. So I've known a couple that had adopted like a Russian baby from an orphanage in Russia. Would that be kind of what you're talking about? The, you know, traumatic maybe birthing, maybe losing their parents, growing up in that, and then being adopted into a new language. Would that be sort of what you're talking about too? Are you
Are you
there?
there?
Yes.
I just missed everything you said. It all froze up.
Okay. Okay, that's all right. No, I was just saying I knew a couple that had adopted a baby from a Russian orphanage, and they had that. It sounds like similar kind of things that you're talking about, where they had troubles with the, not, you know, not really fitting ADD or autistic, but developmental issues. Would that be a
Right.
fair example?
Yes, that's a perfect example. Very often there was a lot of lack of stimuli of both sensory in the first year or two. They weren't held in uh, in many ways. So neurofeedback can
Are you there, Carl? I think we froze up again here. So can you go into not in extensive detail, but can you go into how it works? What do you do with a patient when you're giving them these neurofeedback treatments?
Okay, it's amazingly simple. Um, we put electrodes on someone's scalp, just in 3 places, and the electrodes go into the computer, read the brainwave into the computer. The computer is sort of functioning. And so this is kind of the simple answer without going into the too many technical details. So then all the person is doing is watching a video on a video screen, but the video, embedded in the video, is the feedback from the computer. So that's the biofeedback. And the computer is feeding back information about the brain waves and about how the brain waves are, how well the brain waves are doing in cooperating with what the computer thinks they should be doing in order to improve themselves. So the computer is kind of showing the brain how to move in the direction of improved functioning. And many people have the idea that you kind of consciously retraining the brain. And in earlier models of neurofeedback, there was a way of doing it where you would consciously try to increase your beta waves and decrease your theta waves, or increase your alpha waves, and so on. But that's not the way this works now. Now it's just more, all the changes are programmed into the computer, and
I think we're having a little bit of bandwidth issues here. I'm afraid.
are you going to be able to edit out these problems?
Hopefully, yes. I think
Well, now
we'll
I
end
just,
this.
wait. There was an error loading around.
I think we'll end this session here, and we'll talk about in more detail about some of the specifics of what you can do with biofeedback in the next session, if we could. So I'd like to thank you for joining me today, Carl, and introducing folks to using neurofeedback, probably in what I would consider some revolutionary ways to treating some very difficult issues that folks have in their lives, and in a relatively short amount of time that you can help them with.
Yes, I should mention that neurofeedback, when it first started, it took 40 to 80 sessions very often. Typically, ADD needed 40 to 60 sessions. But now, thanks to improvements in the field, we're able to get many changes in 10 sessions. I mean, sometimes something is cleared up in 5 sessions, say if somebody has insomnia or some ADD cases. But then it needs a few more in order to really stabilize the changes. But very often we get amazing changes in 10 to 15 sessions. Now, I can't say that always happens. You know, some cases are complicated. I'm not, you know, this is a wonderful, amazing thing, but it's not a miracle either. I would never make that claim. So sometimes, for whatever reason, it just doesn't work as well as we'd like it to.
Sure. As in any therapies, I would imagine.
Yeah.
So just in closing, if you could just tell folks, I mean, you went from a long time background doing it sort of, well, I don't know if old school is the way to work it, but you found this, and what has it meant to you as a clinician to help folks in this new fashion and see these kind of results?
I think it's the most amazing work I've done. Honestly, I enjoy coming to work every day. Almost every day something happens that I just really get a kick out of. Somebody tells me that I've changed their life. Some parent tells me that their kid is just functioning so much better than they were before, or some just amazing thing happens that I didn't even expect. Neurofeedback can have sort of more subtle effects where people just feel a more general sense of wellness and equanimity, equilibrium. It's really just amazing. And for me, when I think of the old days of working in clinics where all we had was giving people stelazine and God knows what other medications, it's just a whole different world, and it's just, for me, it's just wonderful to feel that I'm contributing to it.
Very good. That's awesome. Well, thank you very much for joining me today, and we'll be bringing folks more about neurofeedback and some of the specific areas that it can treat and some of the anecdotes. So thank you very much for joining me today, Carl.
Okay, thank you.